Okay. Let's see. Try to get this to come up. Hopefully. I think that's recording. All right. So this is bone. So this is lecture 1 on for test 2. So we'll go a little bit into the different types of bone and how bone develops. So if you see this under a microscope and I ask you what type of bone is this, you would say spongy bone, because there are only 2 types of bone, spongy and compact. They have a different appearance, especially under a microscope, but it's the same stuff. Okay, we're not talking about how did it develop. Did this come straight from stem cells, or is this coming from cartilage? But we'll get into that in just a little bit. Right now, I'm just looking at this spicule, they call it, a bone right here, and say, what type of bone is that? You would go spongy. Now, this is developing by what they call intramembranous ossification, but we'll get to that in just a little bit. If it develops from cartilage, that would be endochondral ossification. But right now, let's just concentrate on the 2 types, spongy and compact. We're not going to worry about how they developed. So, functions of the skeletal system: structural support, mineral and lipid storage, blood cell formation. So don't forget you have red bone marrow that's making blood. Yellow bone marrow is mostly fat, but there's also it can be called upon to make blood if necessary. Protection of organs. Just think your hard ribs on the outside protect the soft, heart and lungs and stuff like that on the inside. Same thing with your skull. It protects the brain. Leverage for muscles. So these are, points of attachment on your muscles attached to your bones, obviously, your skeletal muscles, hence the name skeletal muscle. And so that can, those muscles can move your skeleton. So the composition of bone. Calcium makes up much of the bone mass. The calcium crystals give bone its strength. Hydroxyapatite, calcium 10, PO4, 6, OH2. I'm not going to ask you the chemical formula of hydroxyapatite. But if I say, what's the inorganic crystal of bone? Just give me that answer, hydroxyapatite. Collagen fibers that are mixed in with the inorganic components, that gives bone its unique characteristics, just slightly flexible, fairly lightweight. Bone's a living tissue. So these two, hydroxyapatite versus plus the collagen, give the bone its unique properties. I'm not going to put pie charts on the test, but this is just kind of showing you the composition of bone, how much calcium, what percent's potassium, sodium, magnesium, carbonate, phosphate. So these are all inorganic components they're talking about, where if it's got collagen, like organic is carbon-based, then that would be the organic component. So, most of the bone is inorganic, but it does have this organic component. Not going to ask you percentages of any of these things, don't worry. I could say, is bone a living tissue? And you would go, yes. So you can see the blood vessels, coursing through there. So the cells, osteocytes, osteoblast, those need nutrients. And how you're going to get nutrients? Well, you need a blood supply usually. Okay. This is just showing you they took a bone that looks like probably a fibula, the little one in your lower leg on the lateral, and then they took all of the inorganic components out and just left behind basically the collagen. It's just showing you how flexible that component of the bone is. Okay, osteoprogenitor cells. Just another name for stem cells or mesenchymal cells. Sometimes you hear it pronounced mesenchymal. I say mesenchymal. So the stem cells can make osteoblast. And so that's basically a young bone cell. And then those can become osteocytes, which basically they're older and they have what's known as a lacuna. An osteocyte has a lacuna around it. And I'll show you what those look like. And anyway, they get trapped in the matrix that they secrete. Another bone cell is called an osteoclast. So these are completely different than an osteoblast or an osteocyte. These are cells that release acid type substance, an acid type substance to degrade the bone. So the mechanism to release calcium into the blood, the osteoclast, control that. So it will free up the calcium and put it into the blood, where osteoblast will take calcium from the blood or the tissues and put it, into the bone. So these two things can help regulate osteoblast and osteoclast. There's kind of like a yin and a yang thing going on. They can regulate the calcium levels in the blood because it's very important to have that fairly tightly controlled, the amount of calcium in your blood and your tissues. Very important. Molecule. So the two types of bone, this is what I kept talking about on the first slide, compact bone and spongy bone. So compact bone is dense and solid. Spongy bone is kind of like a honeycomb. It's an open framework. Both types are found in most bones of the body. It's the same exact chemical composition. It's just a different look, a different morphology to them. The spongy bone is generally deep to the compact bone. The compact bone is generally superficial to the spongy bone. So here you can see deep, this is getting in here. So there's your spongy. You can even see it with your eyes, right? It looks like a honeycomb. So you look at it under the microscope and you'll see those spicules like we showed you. The compact bone is going to take on a completely different configuration. So this is in the periphery of this long bone. And then look at the osteon. They call this little circular area an osteon. That's the functional unit of compact bone. And so it takes on this configuration. So this, when you cut across it, it's kind of hard to see right here, but it looks glassy and smooth to your eye. It's a lot more dense. So this is really dense compared to this. So the compact bone is compact. The spongy bone is spongy, hence the names. So there's an osteon. It's kind of cool. So from all the way across that circle right there, it looks like a tree that's been cut across, and you have the rings in it. The rings are called the lamella. And the canal in the center is called the central canal. That's what I call it. But you can use the old name, Haversian Canal, if that floats your boat. I say central canal. This would be a lacuna, a lacuna, a lacuna. Lacuna with an A is singular. If it has an AE, that's plural. It's more than one. There's one more thing you can see on here. See these little cracks that are radiating out like spokes of a wheel? Perpendicular to the lamella. So lamella, remember, are rings. Don't confuse that word with lacuna. They sound a little bit alike. A lacuna is the space that an osteocyte would live in. Right? It's the little house, basically. And the canaliculi, the little perpendicular cracks that are radiating out. Basically, don't forget, there's cells inside of these lacuna, osteocytes, and they need nutrients. So you get that through these canaliculi. And so we're not going to go into on a microscopic level. They're basically little cytoplasmic extensions that go through these canaliculi. But anyway, just suffice it to say for us, that stuff can flow down the canaliculi. Okay, so that's the way that these osteocytes get fed, get their nutrients. Okay. So lamella, like we were talking about, Mainly, I think there's 3 different types. Don't stress on this. I rarely ask this. Maybe a bonus. Concentric rings, the ones that are going like in concentric circles around a central canal, that would be concentric lamella. Okay. Interstitial lamella. This is kind of poorly written. There's 3 types of lamella: interstitial, concentric, and circumferential. So interstitial lamella are these. So you see in between the little circles, there's just like pieces. Probably these were osteons once upon a time, and they just got remodeled. Bone is constantly remodeling. It's it's constantly either resorbing or laying down, adding to in places. So that happens on a regular basis. So these little lamella that are in between the osteons, they just call those interstitial lamella. And then the lamella that goes, see the way it looks like almost like a racetrack going all the way around the circumference of the bone, that would be circumferential lamella. They're all lamella, right? Probably on a test, say this under a microscope, and I say, what's the pointer on? You go, central canal or haversian canal. What are the rings that are around that central canal? And you would go, lamella. It would be nice if you said concentric lamella, but they're lamella. Okay. And you can see out in here, that's probably interstitial lamella. I'm probably not going to point at this guy on a microscope. See this canal? This is called a perforating canal. So if you look here, you see here's blood vessels outside of the bone, and then they're cutting through here, transversely across here. So that's a perforating canal with these blood vessels in here. It just looks like a mess, it just looks like a blob on a slide because they usually cut it at some kind of weird angle. Central canals are very easy to pick out. And you can see the central canals here with the blood vessels inside. All right, so that is a nice looking spicule. You can also call it a trabecula, right? Trabecula technically is singular, and if it had an AE, it would be many of them be trabeculae. So I generally say spicule, but every now and then somebody will take an x-ray, say your doc or another healthcare provider will take an x-ray and go, oh look, I can see the trabecular pattern of bone on the x-ray. And that's just the little honeycomb effect of the spongy bone. This is red bone marrow, right? And this is fat, so that's probably mostly yellow bone marrow. But here is where some blood can be being made, okay, or blood components. So you can kind of see a lacuna starting to develop here, really nice. Lacuna. All of them technically. They're just kind of tiny. We're zoomed way out. That's probably a blood vessel that got trapped, right? Same thing here. It looks like a little arteriole. Okay, so if this is under microscope, really all I can ask you is, what type of bone is this? You go, spongy bone. The pointer is on what pink, well, it's kind of purple here, structure. You go spicule. If you say trabecula, that's fine too. This is bone marrow, right? What's its function? Yeah, helps make blood or stem cells for blood or whatever. So trabecula, pieces that form the framework of the spongy bone. It's lightweight, but it's still strong. So we talked about that. I'm not going to get into this, to the compression lines and tension lines, but I do like this picture here. And you can really see the spongy bone. See, it looks like a honeycomb. And then you can really see the compact bone. And then here, this hollow area, that would be the marrow cavity. You can also call it the medullary cavity, like it does on other in your book and I think on this PowerPoint somewhere too. I just say marrow cavity. It's not showing it, but on the outside right here, that would be hyaline cartilage on the outside here. Okay, this looks like the top part of a femur, by the way. So there, it's just a drawing of a bone. Probably looks like a tibia, you know, the weight-bearing bone in the lower leg. That's what it looks like. The artist tried to draw here. But you can see the spongy bone. You can see the compact bone. You can see the marrow cavity, right? Medullary cavity. Okay. Interesting note here, you can see the periosteum, which is around a lot of this bone, and that's basically connective tissue, a little bit of cellular layer underneath it, but it surrounds that bone. And then you can see the blood vessels going in, right, in that little foramen and going inside the into the bone to feed it. They're not showing all of them, obviously. I mean, they're not showing all the blood vessels in here, obviously. Let's just look at the generalized end. An end of a long bone, whoop, it's called an epiphysis, right? This technically, if it was towards the top, which it looks like it is, say this is towards the knee on a tibia, that would be the proximal epiphysis. This is down by the ankle. That would be the distal epiphysis. That's just the generalized end. So if I ever ask a question on a bone, I go, what is this generalized end called? It's an epiphysis. Probably it would be nice if you told me a proximal versus a distal epiphysis, but it just depends on how I ask the question. What specific generalized end this is? Proximal epiphysis, right? Diaphysis basically is the shaft. Shaft is a half a point. Diaphysis is the whole point. So if I put the tape from here to here, and go, what generalized area of bone is that? I'm asking diaphysis. Whereas if I point at this, see this little growth plate they call it? That's an, well, if you're not growing anymore, I don't guess they call it that, but then it becomes a line, and they would call it an epiphyseal line. Now, that probably has a little bit of cartilage left over in there, and we'll go over that next lecture mainly. And so this is an epiphyseal line. Now, technically, the area that the epiphyseal line is in, and this is in your book, they call it the metaphysis. Yeah, it's, if I pointed at that and you called it metaphysis, I have to give you credit because that's the area. But mainly, I'm wanting you to say epiphyseal line. If this was a teenager, it would be thicker, you know, someone growing. It would be a little bit wider, and it would be an epiphyseal plate. So it has a little bit different appearance on a growing person than on an adult that's already finished growing. So the periosteum that we talked about, the connective tissue membrane on the outer surface of the bone, it's almost like the pantyhose over a leg, you know, it's really, really closely adherent to the bone. So it's not on the articular surfaces. That wouldn't make any sense, right? You have hyaline cartilage there. So are there nerve endings, or basically they're receptors in this periosteum? So it's kind of a double layer. You got the cellular layer underneath, and you got the fibrous, basically collagen on the outside. But yeah, if you bumped that, say with a needle, you guys will be given shots. A lot of you guys will one day. If you bump that with your needle, is that going to hurt? Probably, right? So be careful when you're giving shots, right? It'll be kind of a dull pain. It's not going to feel like when you hit a nerve, you know, that'll be more like an electric shock kind of feel. This will still hurt, but it'll be a little bit different type of pain. So try not to do it. Endosteum, what the heck? Peri, around the periphery. Endo, you know, it has something to do with inside. So around each and every spicule, there's endosteum. Lining the marrow cavity, there's endosteum. There's even one more place, there's endosteum. Okay, see all this pink stuff they drew? That's endosteum, right? Lining the marrow cavity, that would be endosteum also. One more weird little place there's endosteum. Sounds like a bonus question. It's inside, lining the central canals. So why? I don't know. It just is. So lining the inside of that would be endosteum. Right? We'll do this, and then we'll take a little break, start another lecture, another whole nother video. So 6 classes of bone based on shape. So you got long, short, flat, irregular, sutural bones. They're trying to get rid of that one, by the way, and sesamoid bones. Okay, so there's one more category that's in your book now, and it's called a pneumatized bone. It starts with a P, like, pneumatic, like a pneumatic drill runs on air. Pneumatized bone, it's really spongy, really, it's very delicate. So there's really mainly one bone that's pneumatized bone. It's called the ethmoid. And we'll point that out on another lecture. But if you could pull the ethmoid, it's a facial bone basically, or part of the skull in a way. It's kind of hard to describe it without a picture. But it's very, very delicate. So if you held that in your hand and you just close your hand, you would crush it into 1,000 pieces. So I'll show you that one later. So a long bone, that's very easy to figure out. Oh, humerus, a radius, a tibia, a femur, the long bones. Short bones, okay, so here's a long bone. Okay? That's the humerus in your upper arm. Okay? So that's a long bone. These are short bones, like these carpals. There's other short bones, but these carpals, those are short. Don't confuse these. See these metacarpals right here? And going down into your finger bones, basically, down here. All of those, in your digits and your metacarpals, those are little bitty long bones. They have epiphyseal ends. So don't confuse those. Don't call these short. Right? These are short. Okay? Flat bones. Remember? Long, short, flat, irregular, suture, and sesamoid. Flat bones, I know they have a little curve to them here. Mainly when I talk about flat bones, I'm talking about flat bones of the skull. But are there other flat bones like your sternum? Yeah. That will become important, the distinction between these, when we talk about how do they ossify, how do they develop. Flat bones of the skull, just store this in your brain for a little bit later, use intramembranous ossification. So these guys were never cartilage. Basically, the stem cells just became osteoblasts and it developed from there. Okay, there was no cartilage step involved. Just store that in your brain for now. Okay, so notice the way you got compact bone on the outside, spongy bone on the inside, just like normal. Yeah. So the parietal bone, frontal bone, occipital bone, those are flat bones of the skull. Vertebra, that would be an irregular bone. There's others, but that's a good example. Irregular. Some of the bones of the face and the vertebra. That ethmoid bone, by the way, used to be called an irregular because it is an oddly shaped one, but they gave it its own category. So technically, guess what? If I say, name 6 classes of bone based upon shape, give me an example of each. But you gave me 7 because you put in the pneumatized bone. Probably you get a bonus point. Okay. So there's an irregular, a vertebra. There's others. There's other irregular bones. There's a patella. That would be an example of a sesamoid bone. So this developed in a tendon, basically. Okay. There's some other sesamoid bones, but that's the best example right there. And then here's the weird little sutural bone. It's not real. They're trying to get rid of this as a category because really it's just this little suture line just made a weird little curve, weird little circle and trapped some bone in the middle of it. And they're calling that a separate bone. right? So the only reason I bring it up is because you can see these on an x-ray a lot of times, and it might look like a crack or a fracture or something. Um, and the doctor will go, oh no, that's just a little sutural bone, right? Um, so uh, the old docs, they're probably going to call them wormian bones. You might want to store that just in case. Very rarely do they use that anymore, but it's called wormian, wormian. Could be a bonus. That sounds like a good bonus question, right? Okay, so there's our 6, or technically 7, classifications of bone by shape, right? And then next time we'll go into some different structures, like that would be a line. You know, that's a superior nuchal line. That's an inferior nuchal line. You have different structures called condyles and processes. You know, so we'll go into that on the next lecture. Okay, so everybody's cool. So what did we learn? We learned there are 2 types of bone, right? Spongy and compact. We learned a little bit about what makes up the bone, this hydroxyapatite. That's basically the same stuff that's around coral in the ocean. You know, it's made up of that. They've even used that as a bone matrix or substitute when in certain places. You know, people that had bony defects and stuff like that. They even used to coat implants with hydroxyapatite. Say that the implants used to be made of stainless steel, and they couldn't get the bone to grow to them like they can with titanium nowadays. So they would coat the stainless steel with hydroxyapatite, and then the bone would grow to the hydroxyapatite because it, you know, so similar. But anyway, we also talked about the collagen fibers and the organic component of bone. We talked about the functions of bone. We talked about what kind of cells make bone, osteoblasts. Once they're mature, then they're called an osteocyte, and they have a little lacuna around them. Osteoprogenitor, just think stem cell, mesenchymal cell, generic word. Osteoclast, break bone down. They kind of degrade it, and it will free calcium up, put it in the blood. Osteoblasts lay bone down and take the calcium out of the blood and tissue and put it into, or out of the blood and into the bone. Okay. Both types are found in most bones of the body. So compact and spongy we talked about. And we talked a little bit about an osteon and the different components. And we talked about the different types of lamella, but really I'm probably just going to point at a concentric lamella. We talked a little bit about red bone marrow, right? We talked about different regions on a bone. We talked about periosteum and endosteum and where they're found and where they're not found. Periosteum is not on the articular ends. That's hyaline cartilage. We talked about epiphyseal lines. Okay, so everybody's cool? All right, that's enough for one lecture. Okie dokie. So I'll load this onto YouTube for you. Okay.